Hello and welcome to my channel. My name is Anna and I'm a registered nurse with experience in NICU and pediatrics. Honestly, my favorite part of being a nurse has been educating new parents. I feel like the more information they have, the more at ease they feel. Therefore, today we're going to talk about skin to skin and all of its glorious benefits. It's amazing how this seemingly simple practice holds the power to create an unbreakable bond and bring forth a multitude of benefits for both babies and their parents. Let's start by explaining what is skin to skin contact. It's commonly known as kangaroo care within the hospital. Skin to skin involves placing a newborn directly onto the parent's bare chest, creating an immediate and intimate connection that fosters bonding through an emotional and physical connection. Everyone always talks about how good endorphins and dopamine makes you feel, but there's also another hormone called oxytocin. Skin to skin contact triggers the release of oxytocin, which is also known as the love or the happy hormone. This surge of oxytocin creates a sense of security and bonding for both the baby and parents. Now, there's several immediate benefits for skin to skin after birth. Skin to skin helps the baby regulate their body temperature, their heart rate, and breathing. The parent's body temperature acts as a human thermostat, adapting to the infant's needs and providing a comfortable environment. Here's an interesting fact. Normally, newborns' heart rate is 120 to 160 beats per minute, but during kangaroo care, they may be on the lower end of that spectrum, sometimes even fall slightly below. This is considered a positive sign. It means that your baby feels secure and relaxed. It's just the same as when an adult lays their head on their partner's chest, and with time, you notice that the breathing and the heart rate starts to synchronize. When you are first admitted onto the L&D floor or while drawing out your birth plan with your obstetrician, you can express your desire to start skin to skin immediately at birth. As long as mom and baby are in no immediate danger and it's a natural birth, not a C section, when the baby is out of the womb, they can be placed directly onto the mother's chest and then start the process of delayed core clamping. The advantages of skin to skin contact go far beyond the initial stages of childbirth. Research has shown that children who experience consistent skin to skin may exhibit enhanced cognitive development, improved emotional regulation, and even bolstered immune system, especially when paired with breastfeeding. Many parents even say skin to skin heightens their sensitivity and responsiveness to the baby's needs. Aside from physical benefits, there is an emotional connection that skin to skin nurtures. It fosters a sense of trust, security, and feeling of belonging for the baby. For parents, it serves to establish certainty in their caregiving capabilities, thus creating a sense of confidence. Now, don't think skin to skin is only for the mom. Any family member can partake. Dads, grandparents, siblings, adoptive parents. Moms just get more of the action, especially while they're breastfeeding, as it stimulates the release of oxytocin. The hormone is responsible for milk production as well. Skin to skin is a love language. It is an opportunity for all parents to connect with their baby on a level not understood by many. It is a shared experience that contributes to the holistic development of a family. You may be thinking, when is the best time to practice kangaroo care? There's no specific time. It can be done at any time that's convenient to you. You can start from the moment that they're born until they're big enough to run away. As a newborn, usually kangaroo time will be anywhere between 1 to 2 hours. This is based on how long the caregiver can stay in place and if the baby wakes up to feed. Though honestly, I have found that babies in kangaroo care are so comfortable and sleepy that sometimes the caregiver or you as a parent have to actually wake up the baby to remind them to eat. In my experience, and what makes the most sense to me, is skin to skin is best after they feed. The baby is not full, their diaper has been changed, they're ready to go to sleep. So just having them on top of your chest is an excellent time because they're already calm and settled. Plus, if they have any reflux issues, having them upright will just help them digest better as well. Another question may be, when can preemie babies partake in kangaroo care? Good news, there's no particular gestational age that they need to meet. They just need to be hemodynamically stable in order to be able to tolerate the activity. Normally, I would start my preemies with 30 minutes, and if they're doing well, I'll leave them on longer as long as they're adjusting. If not, then we'll start with little increments every day or every other day until they do start to tolerate it. Some signs that can signify they're not ready can be restlessness and increased work of breathing. like they're breathing more frequently or they're breathing harder. So you can see their chest moving up and down more visibly. Also, the most common sign is braiding, which is when their heart rate drops below 80 and then they have to be stimulated in order to return back to normal. As a parent who would want a kangaroo, I would just discuss this with the nurse in charge of my baby's care that day so that they can gauge whether it's a good idea to start. Sometimes babies can have a bad day where they just need to have minimal stimulation so that they can recover. Also, there may be certain levels of acuity where it's not recommended. For example, if they're intubated and if they have umbilical lines, it just depends on the nurse's level of comfort and the parent's level of comfort. It's a discussion. One thing for sure, do not do skin to skin if you're sleepy. It is a hazard to fall asleep while holding the baby. You can turn around and not notice that they fall or they're suffocated. If you are sleepy, just leave them in the crib. In conclusion, the benefits of skin to skin contact are immeasurable. So embrace the power of skin to skin contact and start reaping the benefits today. Your baby will thank you and you'll experience a healthier, happier you. Again, I thank you for watching and hope you learned something new. As always, please remember this channel is for educational purposes. All information shared is based on my current cumulative knowledge, personal experience, and research. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Be sure to always seek professional medical advice from a qualified physician or healthcare provider with any questions you may have regarding a medical condition. If you found this video to be useful, don't forget to like, subscribe, and share your thoughts in the comments below. If there's any specific topic you'd like to know about, comment below and join us next time.